I just watched an interview on Channel 5 for a group called the Association for Parents with Marijuana. And it interviewed a colleague of mine, DJ DeBold, who did a very, very good job. Evidently, the association believes that they become better parents with marijuana. Now, a number of those people do have some medical conditions that certainly might be helped by marijuana. But to claim that marijuana helps parenting is patently absurd. They did show SPECT scans, which are brain imaging scans of the brain of somebody with marijuana. Where it affects the brain is in the prefrontal cortex, which is our executive function. It's what allows us to be patient and to focus and to follow through and to have good judgment and not be impulsive. And those are extremely important skills for a parent. What happens when you smoke marijuana, when you have attention deficit disorder, or when you're drunk, 40% of the brain goes asleep. That means that the prefrontal cortex essentially shrivels, and it appears on a SPECT scan to have holes. That's because the blood and the electricity have drained out of the system, and that causes a person to be impaired. In my opinion, the marijuana laws are justified in certain conditions. Marijuana is a drug like any other drug, just like morphine. And morphine is an extremely good drug if your leg is halfway cut off. However, it's not a good drug for a headache, and it certainly doesn't make you a better parent. Unfortunately, one of the things that we're seeing is really a great rationalizations. We've had recent people in the state of Arizona claim that marijuana actually helps attention deficit disorder and that it helps Alzheimer's disease. And it does exactly the opposite. The dopamine is affected, the executive function is affected. It would actually impair those two conditions. Does it help with glaucoma, cancer in terms of adding appetite? Some pain responses, yes. Are there better alternatives for pain? I think so, without question. The real important thing is to look at any situation as logical, not through intense emotion or wishful thinking or gross rationalizations, which I believe this group is certainly doing. If you care to see what SPECT scans look like when the executive function is down, you could go to ADD-care.com and look at the SPECT scans that we did with my ADD clients. Or you could go to amenclinics.com, and there you can see not only ADD clients, but people impaired on alcohol and marijuana.